All right, good evening, Winnebago community, Winnebago membership, and Winnebago workforce. This is the bi-weekly COVID-19 update for the Winnebago Tribe of Nebraska. And I'm sure everybody's aware of what's going on in Winnebago. We are experiencing a wave of positive cases and quarantined houses. And I just wanted to assure the community that this is something that we have planned for and that we are well capable of. We have put a lot of good things in place, and we kind of knew that we're going to be dealing with this in waves. And so I wanted to reassure everybody and understanding that school's starting up. We had some events. So there's a lot of different things that happened. And we're going to be discussing the updates as far as the healthcare and the school and all the stuff. So I just wanted to reassure everybody that that we are capable and that we have planned for this, and also that that we might be getting a little relaxed. And so I wanted to encourage everybody to really understand that we are in the middle of this pandemic, and that we shouldn't relax, and that it's going to take all of us as a community to get through this, and we're doing really well. So with that, I wanted to pass it along to this week's update. Thank you.
Great, thank you, John. Next up, we'll have Danelle, CEO of Winnebago Comprehensive Healthcare System. Danelle?
Thanks, Emily, and thanks, John. And thank you all for joining us for this week's community update. As John said, after a period of declining cases, we are seeing an increase over the course of the last week or so. And in our presentation today, Mona Zivante will go over some more specifics about the current statistics and the data that we have about the cases. And I too would like to once again remind everybody that the best defense that we have against COVID-19 is physical distance and mask wearing. Whenever possible, we encourage you to stay home or stay away from where people are gathered, to try to avoid situations where you're going to come into contact with people that are outside of your household. If you do need to go into public places, it's very important for you to keep at least a 6-foot distance away from other people. It's also very important for you to continue wearing a mask and make sure that your mask is covering both your mouth and your nose, so that can help to protect the potential spread of COVID-19. We know that things are opening back up and school's in session, a lot of people have gone back to work. So when you're in those circumstances, again, it's just really important for you to wear a mask, practice physical distancing as much as you can, and remember to use sanitizing efforts, washing your hands frequently, and sanitizing high-touch areas. These are the things that we do know about COVID-19, and these are the practices and things that all of us can do, each individual can do to help prevent further spread of COVID-19. COVID-19 testing also continues to be available at 12 Clans Unity Hospital. So if you are experiencing symptoms or if you otherwise wish to be tested, you can call the outpatient clinic at 402-878-3404 during regular business hours to schedule an appointment for a COVID test. Just as a reminder to everybody that COVID-19 testing also is not an emergency. So that's why we're doing it through this important appointment process. And generally those appointments are done through the outpatient clinic, and we set those up to be done as a drive up. So you don't even need to come into the facility at your appointment time. You can just drive up over by the ER entrance on the east side of the building. Testing only takes a few minutes to be done, and then you'll be contacted with your results as soon as the result is available. Our turnaround time for testing results continues to be pretty good compared to other parts of the state and the area. And oftentimes, again, just depends on how many tests are being run and what test is used. You'll be notified anywhere between 1 to 3 days of your test results. Also, keep in mind that testing too early after an exposure can result in a false negative test, and that's why it's very important for you to take the recommendation of public health to quarantine for the entire period of time after an exposure. So the COVID test only tells if you are positive at that point in time, And if it's too early after your exposure, it can result in a false negative. So even if you do test and it's negative, you still need to quarantine for that full period of time. That negative test doesn't mean that everything's okay and you can go back to work or go back out into public. If you have any questions at all about a potential exposure or about symptoms or anything like that, the COVID-19 hotline is still available from 8 to 4:30. So during regular business hours, you can call the COVID-19 hotline. And that number is 402-922-1508. And a public health nurse or a public health department representative will be available to answer any questions that you might have. With that, I will turn it over to Mona for this week's presentation. Thank you.
Thank you, Danelle and John. Good evening, Winnebago community. I know I've seen many questions about what is going on and what are we doing. So what's going on is, of course, we've seen some increased positives in the past few weeks. Many are linked together, as we will see shortly in our presentation. We're trying to respond as the situation presents itself. We place people in quarantine or isolation as appropriate, and we coordinate services and do the best that we can. The reasons behind the virtual learning for both Winnebago Public School and EduCare has been because they've met their threshold for what was necessary because of the households that have been affected. Our community members have several comorbidities, and therefore we try to be proactive on what occurs within our community. Also, the closures allow us to respond and finish the close contact investigation and prepare for the next ones. We all knew that this was going to happen because we still do not have a vaccine that's readily available to us. And people are lowering their guard and not wearing their masks. I know that is confusing about when people are in and out of isolation and quarantine and who is in close contact. So I wanted to kind of go over that a little bit again. Who is a close contact? Anyone that's come into direct contact with someone that's tested positive 3 days prior to them feeling ill and that have not had a mask on. So what is isolation? Isolation is for those that have tested positive. They must stay away from others for at least 10 days from when they started feeling sick. And then quarantine is a bit different because we have to watch those people for 14 days to see if they get sick. And they usually have to stay in longer. So it's any time between 3 to 14 days, they should usually starting to be sick. But quarantine within a household is a little bit harder. We have to watch all of the family after the positive person has been released. And that's why it does take a long time for some of our quarantine households to return to normal living. But if you don't live within a house and you've just been in contact, then it is just 14 days from that last contact. I also want to remind people, we do have housing options available. If you're not able to stay in your house or in a separate room. So if you've tested positive, we do have the cabins that are available, and they are single dwellings. And if you've been in close contact, we have the little pre-storms, and they have multiple units in there. So there is some common areas that you would have to share. We're going to be working with Emily to develop some posters to help us assist with the services and present that to the community. But if you're concerned with your living situation, depending on whether you've been a close contact or a positive, you can let your assigned PHN know, and we will get the appropriate housing for you to become available. I also wanted to apologize. We've had a very high volume of calls on our hotline. We will be looking at adding additional nurses back to the hotline so that we can meet this demand. Before I close and move on to the data portion of the updates, the Winnebago Public Health Department continues to be responsive as the situation presents itself. At the times, the system does get overwhelmed, but we did know this was going to happen. And we have placed mechanisms in place for us to reach out, close areas in order to give us some more time. I also want to remind, as Danelle has said, to call, you can directly call the 12 Clans Unity Outpatient Department in order to set up your testing, which is not recommended before 10 days of your last exposure with a positive, just in case there's a false positive. And I also want to reassure the community again that we are working diligently to identify, quarantine, or isolate, and then monitor and test as the circumstances warrant with each case, because everyone is different. Please remember when you're participating in activities that you can't tell who has a virus and who doesn't. But that is why it's so important to wear your mask. I know I've said this last week, but I know that we will get through this and persevere just as all the other ones that have come before us have, by supporting one another. We are in this fight together, and only together will we be able to defeat it, by taking it one day at a time and continuing to make the decisions that will ultimately help us reduce our numbers. But we're all in this together, which means that we all have to wear our masks and social distance where it's appropriate. But it's up to each one of us to do our parts. So looking at the numbers for our presentation, so these are yesterday's numbers, which indicate that we had 3 positives, 24 actives, 128 positive cases since April, 3 deaths related to COVID, 101 recovered, and we have currently 39 households in quarantine. So I just wanted to show a little graph for the positives over time, and you can kind of see the amount of positives kind of ranged throughout the months since we started this journey. And so you can see, as Danelle described and John, that we've had some peaks back in May and now again in September. And so this particular bar graph shows you that we've had 63 individual contacts. So what that means is that there were 63 people that had no other relations to others. And then we had 70 people that were connected to one of those 63 people. So just to show the female-male breakdown, there wasn't too much of a difference, with males just being a little bit, having more positives with 51%. And then our noticeable difference was within our age of positives, with between 20 and 29 years of age, which indicated there was 31%. So our young people are a little bit more positive than everybody else. And so we will be doing some more investigation in that, and we'll be presenting some of that information back to the community to identify those areas where we are seeing those locations of possible areas of exposure. So I want to thank you all from the Winnebago Comprehensive Healthcare System, and just a reminder to please social distance and wear your mask. Thank you.
Thank you, Mona. Next up, we will go to Dan Feringer from Winnebago Public Schools. Dan?
Good afternoon, everyone. As everyone is aware, we are closed. We're following the return to school plan. We currently are in the red zone on that plan. This puts us in the remote learning phase, which also means no activities. At this time, this will go through October 2nd, which we will then meet with the health department to consult whether we continue to be in the remote phase or not. The return to school plan is posted on the WPS website. Staff and I just want to reiterate that staff and anyone who enters the building are taking his or her temperature, they're wearing masks, and they're sanitizing hands. We're following the safety guidelines for everyone here. It is imperative, as been said previous, that health safety measures are practiced: social distancing, the wearing the mask, and temperature taking when applicable. So we do appreciate some of the support we've had from parents. We appreciate the parents contacting us throughout. They've been very good about that, letting us know, and then also working with the health department on as we move forward and set up plans for the daily routines and what we're doing. So I just want to thank Mona for taking my calls early in the morning throughout the day. It's been helpful as we move on in this pandemic era. Thank you.
Thank you, Dan. Next up, we will go to Manoj with Little Priest Tribal College. Manoj?
Thank you, Emily. Good evening, community of Winnebago Tribe of Nebraska. I hope you guys are doing well. As we all know, there's a surge in cases, so stay safe. Follow the guidelines from the public health, the hospital. They're doing a marvelous job guiding the community. Updates from the Little Priest Tribal College. The fall semester is going well. I want to take this opportunity to actually reach out to students. If you have any concerns, anything you need from us, please reach out to us. There's no point just discussing between each other without a resolution. We are here to support you guys. And there is no point finding out about your concerns at the end of the semester. It's too late. We have time to fix now. This is uncharted territories, not only for you, for us as well. This is the first time we're offering completely online courses. So faculty, the staff, the employees of the college are going out of their way to assist the students, but they can only do so much if they don't hear from you. So again, parents, students, if you're listening to this conversation, I just want to reassure you that we are here to help you. But please make sure you contact us. It can be financial aid. It can be registration. It can be a faculty issue. It can be a student internet issue. It can be any sort of issue. And we also would like to hear some good things we are doing. Any good news during this time, will bring a smile on our face. So if one of our faculty has done a commendable job, I would love to see that email as well. So, but we don't want murmur. We don't want, that doesn't solve any problems. The next thing is Little Priest Tribal College is already planning for spring 2021. The Higher Learning Commission has indicated that they will not waive the online instruction, the instruction modality for spring. So what we are doing in fall, they are not going to allow us to do it. So we are coming with the plan for spring 2021, which will have multiple modalities: online instruction, face-to-face instruction, and hybrid instruction. So we're already 4 months ahead planning for that one. Also, a lot is happening at the college. As we all know, that the dorms are used by the hospital to quarantine the patients, the families. At the college, we are trying to create some creative ways to give access to internet to the students, and we're also working on a plan to give access to the community members. So that's something we're working on. Stay tuned for that one. There is a vaccine clinic for all employees of Little Priest Tribal College on October 9th. Thanks to the public health, Angie and Janelle for making that happen. So we are taking precautions to safeguard our employees. If our employees are not well, our students cannot be served, our community cannot be served. We are installing air purifiers in all the buildings, which can remove the hypoallergens and the virus. different types of viruses. All hands on deck to maintain the safety of the employees and the students. Fall, as we know, is the flu season. As a chemistry faculty member and a former chemistry faculty member and a previous med student, I've read enough papers about how this will affect the community if we get flu and the COVID-19. So exercise extreme caution, stay safe, maintain distance. And as Dana said, these are the only ways that's going to work till the vaccine is determined. I've been personally impacted by the COVID-19 in more than one ways. And it's very hard to deal with it. So the better way is not to, to stay away from it. So I just thought of sharing this. I'm not a public health expert by any means, but I just want to share my personal experience with you guys to make sure to take extreme precaution. And again, for the students, please avoid the, murmuring. Just come to us. You'll be surprised. Have a good night. Thank you.
Thank you, Manoj. Next up, we will go to Sam Burrish with HCI. Sam?
Thank you, Emily, and good evening. The annual HoChunk Inc. Community Celebration for the Winnebago Tribe of Nebraska is this coming Tuesday, September 29th. It'll take place as a drive-through physically distant event in the HoChunk Village and include free meals to go, giveaways, and door prizes for lucky winners. The drive-through route starts at HCI distribution and ends at the Village Market. Please stay in your vehicle and follow health and safety guidelines. We've posted a map for this drive-through event on the HoChunk Inc. Facebook page, along with other event details. Again, this event is this coming Tuesday from 4:30 to 7:30 p.m. We look forward to seeing you drive through. Thank you, everyone.
Thank you, Sam. Next, we will go to Mayan with Winnebago. Mayan?
Good evening, Winnebago community. In the past 2 weeks, we've also had a surge in COVID positives and close contact tracing. We've had multiple people go out for quarantine, a few that have already come back to work after their 14 days, and some coming back within the next couple of days. So it's imperative to reiterate what everybody's already said. Wear your mask, social distance, wash your hands. We have disinfectant for your hands and wipes for machines. We've been very strict in our guidelines for reopening, and we've stuck to those guidelines of requiring masks in our facility. Nobody under 18, less hours of operation in some areas, and we shut down the weeknights to do deep cleaning. So we're very confident that, even with all these employees that we have, team members that we have out here, that we've held it down very well. But we also expected at some point we would have surges of positive cases or quarantines just due to the area that we're in. Obviously, if you know the numbers in Woodbury County, right now they're the number 2 in the state of Iowa on rising positive cases. Again, we've done our due diligence here at Winnebago Casino Resort to hold those numbers down to protect our team and our family. Just remember, continue to do everything you can to protect our elders, our children, you and your families in battling this epidemic. And we'll continue to be as strict as possible as we can, but at the same time, make it a fun experience when you come out to gamble at Winnebago. So that's all we have to report this week. Thank you for your time.
Thank you, Mayan. Now we do have a couple questions that came in through the COVID email. As a reminder, you can email any questions you had related to COVID for healthcare officials through the email covid@winnebagotribe.com, and we will do our best to answer them bi-weekly during these community updates. The first question I'm going to direct to Mona was, why are the rising COVID cases? What is going on that's making them rise? Mona, can you answer that one?
So for all of the people that have been placed in quarantine, it's because they weren't wearing their masks when interacting with others. People are participating in activities where wearing their masks are not enforced. And it really does all come back to wearing your mask. We really do need people to help out and wear your mask when interacting with others, and of course, social distance. And then we'll be investigating those cases further to use the chart that we provided today to actually try to tie it back to certain locations to present to the community.
Got it. Thanks, Mona. And then the next and last question is in regards to Halloween. Will Halloween be canceled this year, or does Whirling Thunder or the Boys and Girls Club going to do a drive-by Halloween? Kids want to dress up, and we as a community should do something for them. Just a suggestion. Mona or John or anybody else, I don't know if you wanted to comment on that or answer.
Yeah, sure.
I know we're not gonna, oh, go ahead.
I know we're already having conversations within the tribe, and then the task force on how we're gonna plan for that and make sure that it's safe for all the children. So those conversations have been started, and just wanted to reassure that we're thinking about that, thinking that far out, and we really want our children to have a good time and have a Halloween in a safe way, because we know that happiness is real important, you know, to our lives and to our children, that our children need that kind of happiness. So that's kind of what I got on it, and then I'll pass it over to Mona on her comments.
Thanks, John. Apologize. So I know that we won't be hosting the masquerade for obvious reasons, but I do think that's an excellent idea. I would love to have some type of drive-by, and I'm sure we'll be working with the pandemic task force on that. I'm also interested to see how the HCI drive-by event occurs and see if it's possible to model the same practice for our children and possibly put it at a different location. So I thank you for that great suggestion, and maybe look at a trunk and treat kind of thing. Thank you.
Awesome. Thank you so much, John and Mona. So that wraps up the Q&A portion of today. With the Halloween especially events, if you could like the Winnebago Health Department, Public Health Department on Facebook, and 12 Community Hospital on Facebook as well. We'll be making more announcements for upcoming events and COVID numbers as well on those pages, as well as visiting www.winnebagohealth.com. And we will update those websites with current events and activities and information all in one place. So that wraps up this week's community update. We will be doing this as a reminder bi-weekly, so there will be no update next week unless there is a emergency need to update the community, and then we will do those as needed. But for now, our next update, I believe, will be October 8th. So we'll see you all next 2 Thursdays from now, October 8th. Thank you.